Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another edition of Hilaal Live. Thanks for watching us on channel 347 on DSTV. It's Mental Health Monday, so we continue with very important topics. Last week we covered ADHD, and I hope that was very beneficial to you. And we've decided to continue because there's so much more that we need to discuss. And our panel in studio, first up, let me welcome clinical psychologist Brother Rafiq. Lockhat, assalamu alaikum.
Alaikum salam.
Jazakallah so much for coming in once again.
Always a pleasure to be back.
And then you've brought an esteemed guest with you as well, Dr. Yusuf Lalken. Jazakallah for coming in as well. Assalamu alaikum.
It's a pleasure to be here. Walaikum salam.
We had some very good feedback in terms of last week's episode in terms of ADHD with adolescents, and especially now exam time. We want to make our kids the VIP of the world and give them all the help that they need. So for those that didn't maybe join in and didn't follow last week's discussion, maybe if we could recap, Dr.
No,
Yusuf.
absolutely. I think it's important to recap as it leads into the later discussion as well. I think the first point we made last week is the idea that ADHD is a myth, that it's not really something that we can identify and something that we can in fact treat properly. And so for those parents who look at their children and consider them to be either lazy or disobedient or not motivated, I think we do a grave injustice to these kids, because all children really honestly want to learn,
Of course.
and they want to succeed and they want to be happy. And I think very often it's the frustration in the parents when those things don't happen and they feel powerless about what to do. I think part of our discussion is to let parents know there are things that can be done,
Right.
and it's worth looking into it. So just to recap then in terms of what ADHD is, it's a neurodevelopmental disorder. It has three characteristics. So we observe it in children: the inattentiveness, the inability to process information. We notice the distractibility and the hyperactivity, and we notice the impulsivity.
Right.
So those three factors play out both in behavior and it plays out in performance. So it's important that parents observe their children in terms of those three characteristics, and then seek help if they feel they need some advice, even not necessarily any formal treatment, but some advice onto how to manage and what to do. So I think that's important. And I think the third point we made last week was a whole issue about what are the scientific basis for all of this? Where's the grounding? And it's a well-researched area, Lukman, extensively over many years. And it boils down to really three areas. I think the one is this whole neurobiological aspect.
Yes.
It's clear for us now that there seems to be a mismatch, a atypical connection between two areas of the brain. The one that processes information, meaning everything the child hears and everything he sees is basically sensory information that goes to the brain.
Right.
The brain has to process that. The brain has to give it meaning. The brain has to connect that information in a meaningful way. And then it has to move and connect with the executive function. So once you process this and you know what it's all about, you almost instruct the executive function to implement it.
Right.
And when there's a disconnect between the two, or dysfunction in either the one or the other, you'll find young people confused, disorientated, not quite sure what's going on, wondering why with all their efforts they're not succeeding. It's because of that disconnect. So we know that's the one thing that we have well researched. The other one is the imbalance and poor release of dopamine, which is a chemical that provides us with satisfaction, of achievement, of feeling pleasure in doing things. But along with that, it also helps us to concentrate, to persevere, to make sure that we reach the goals that we set out for ourselves. And very often with ADHD kids, there's a lack of motivation. There's a lack of perseverance, and 9 out of 10 times you meet them, the first thing they tell you is, I can't do that.
Right.
They've already stopped themselves from trying. So that's a connection that we observe as well. And thirdly was the issue that I think you raised at the last session about genetics.
Yeah.
And so there is that genetic connection that clearly would predispose certain children for being more likely to present with certain features of ADHD to a different degree. And I said to you last week that very often dads would be the ones at the end of a session that would, when we give a feedback, would inevitably at some point say, I was I was like that when I was at school.
Wow.
That is me. And coincidentally, this week, I had two fathers who attended the first intake,
Right.
not the feedback.
Yeah.
And at the first meeting, at the end of that intake, when we were just busy discussing the child, he looked at me and he says, "That's my child.
Sure.
He or she is me, and the other two is their mother."
Wow.
You know? So the recognition is there.
Right.
I mean, and people know that.
Yeah.
You know, so those three elements, I think, the neurobiological, the chemical, and the genetic element, does predispose certain children to present with these features. And of course, treatment options are available. And I hope that today we can talk about what those options are. And there's no single approach. I mean, this is the beauty of it.
Yeah.
It's kind of a multimodal approach. There are different things that can be done and different things that can work for a child that I think we can chat about in due course.
Thank
but
you.
just one other thing,
Sure,
sorry,
no
Rahman,
worries.
that I want to add, because I think it's so important because we don't touch on it very often. And that is the fact that the ADHD child, when they present to you, is the most heartwarming, creative, empathetic kind of child. They're the ones who care.
Right.
They're the ones who are concerned about what is right and wrong.
And we could learn a lot.
They're very creative. They're very warm people. I really fall in love with my ADHD kids.
Right.
When you ask them, what are their concerns, it's always about other people.
Wow.
It's never about, I need another Xbox, or
Right.
I need this, or I need that.
Yeah.
I need my brother to be happy. I need my mom to be safe. So they're very warm kids in that sense, that I think it's important for us to recognize about them as well.
Brilliant. Thank you so much for that. I think Rafiq, Dr. Yusuf touched on quite a few important aspects
want to add
around
one
that.
small
And before, if you could add on that as well, but more importantly, the work-life balance comes into play with regards to how the family is then affected by someone that's going through ADHD, and I'm sure this is where your expertise comes into a large degree as well.
Just before the point Yusuf made about the assessment and diagnosis, really important, because it relieves the parents of all the guilt, and also of saying this is a lazy child, this is a stubborn child, this is a stupid child. You know, I started to say, but my child is stupid, he can't get anything. And when people like Yusuf do the diagnosis, you can just see parents relax. They finally have a label, and now they can stop calling the child names, because the child has a real thing.
Yes.
So everybody benefits. The child now knows they're not stupid. They know they're not stupid, but they start getting confused. Often they'll say things like, I work so hard. And they do. I put in hours of work. I don't understand. Nothing sticks in. So I think the assessment and diagnosis is really important to helping the family settle down and understand this is a real thing. But more importantly, we have a plan to fix it.
Brilliant. Yeah. And I think that's, it's a great opportunity for us to discuss the treatment aspect, because now that you've identified what the issues are, now, and you said there's no one-prong approach, or two-prong approach for that matter, to how you would deal with an ADHD child. What were some of after your diagnosis, what are some of the treatment methods that you would take the family through?
So it would depend largely on the age of the child and the particular nature of the ADHD. So generally speaking, we would identify it in terms of 3 levels.
Okay.
So there's mild ADHD, meaning a child who's pretty busy, but gets 7s.
Okay.
Gets 80%.
Right.
The major problem with him is, or she, they're disruptive in the class and impact on classroom management and so on. So we consider that sort of a mild form of ADHD, because otherwise this child is sociable and they're performing well academically. And we kind of suggest to teachers, generally speaking, classroom management is probably a solution for that child, rather than anything else.
So what would you advise if the child's disruptive, if they are, upsetting the typical routine of a scholastic environment? What would you suggest?
So very often it works like this: the child finishes well before the other children. So you give 10 sums to the class, within 5 minutes, he's finished the 10 sums, and now he starts talking to his friend next to him, still at number 5.
Right, right.
And so he can't finish his work, and the teacher's worried about the impact he has. Very simple solution. Give that child 20 sums to do.
Okay.
Keep him busy in that same period of time by giving him extra work. Nobody else has to know it. Neither does he have to know that he's got 20 sums and the others only have 10.
Right.
So he can finish his work in the same time space that the others are finishing it. That's a very simple strategy. And obviously there are many others like that that we can introduce to teachers too. The point I want to make is that there are various factors that influence the treatment sort of options that we have. With younger kids, I find it's essential to check other things. So the parents come and they say, he's not listening. Check the hearing. Check the hearing.
Yeah.
Fortunately, in our practice, we have an audiologist, and we send the child to an audiologist. 9 out of 10 times it's clear, but then we know it's not hearing.
Okay.
But 1 out of 10, there is a problem, and we can follow up on that.
Okay. We're going to continue this conversation after the break, because I think it's pertinent to our viewers with regards to some of the information that you've just passed and how they can better treat the issues that they face in home as well. We're chatting to Dr. Yusuf and Rafiq Lockhat around ADHD. It's a continuation of last week's episode, and I'm sure you must have benefited tremendously from this. After the break, we continue. Thanks for watching us on Hilaal Live. Assalamu alaikum, welcome back to Hilaal Live. Thanks for watching us on channel 347. Remember, you can also download our apps on both iPhone and Android. In studio again, we're chatting about ADHD with Dr. Yusuf Lalken and Rafiq Lockhat, giving us valuable information. Gentlemen, thanks so much. Before the break, we were chatting about some of the treatment that is offered and can be utilized to manage ADHD. What are some of the, you mentioned a very mild condition that can present itself and the treatment thereof. What are some of the other treatments, Dr. Lalken?
For the other levels, obviously moderate and severe. Okay, but coming back to younger children, which is where I would like to see we impact earlier on rather than later. The longer we wait, the more other problems emerge with children. So I think if you can effectively, it's kind of common knowledge that by the age of 3 you begin to recognize certain behaviors in your child, but because the child is at home, you have no kind of context in which to measure it except your family. And so we don't really, at that age, kind of make any serious attempts with diagnosis. I think the minute the child enters either a care center or enters grade R, so roughly about 5 or 6, then you have, in fact, 2 contexts in which to assess the child. And then you begin to see a huge overlap between what the parents are saying and what the teachers are saying. But more importantly, you begin to see the real impact of that in terms of behavior, either disruptive or confrontational or withdrawn or can't write.
Because by that time in their lives, they should be used to a bit of a routine.
Absolutely.
Yeah. So if that is,
not established.
Yes.
Exactly. So that's the point where I think everybody realizes that somehow we need to have a look at it. And so at that age, like I said earlier, I think we'd like to have a much more therapeutic approach to it. And so the meds are not our first option.
Okay.
And so we will ask the parent to assess if there is a hearing problem, as I indicated earlier. Let's then do an audiological assessment and we take it from there. And I would also recommend that you go for speech and language therapy assessment.
Okay.
Find out if there's anything in terms of picking up sounds and blending it and so forth. So the services of the therapist are extremely important. The child could simply not complete work because he doesn't have a good pencil grip.
Okay.
And the minute you go to an OT and we work on the fine motor skills, then suddenly he completes his work. So not everything we observe, we conclude is necessarily immediately connected with ADHD.
Gotcha.
But once you've cleared all of that, that's the issue. Once he's gone for therapy and they've done 6 months of strengthening his muscles and establishing a position and organizing himself, and the behavior and the performance has not improved, I think that's when we consider coming to a psychologist and kind of assessing what is the next best level of intervention.
Okay.
So it depends on the age and it depends on what kind of progress we make at the therapeutic level. And by that I also mean changing of diet. You know, I think that's so essential.
Wow.
We're a fast-moving community. Parents on the way home, they stop for takeaways, but they don't have to cook tonight and they don't have time. And all of that, I think, contributes to poor brain food, for lack of a better word.
Gotcha.
And so areas of the brain that really requires, you know, certain nutritional elements, the kids are deprived of that. So it's important that we really look at a family diet, for example, a family lifestyle that's compatible for everybody.
Brilliant. Doctor, thanks so much for that. I think it's valuable information. Rafiq, these type of symptoms in your practice, in your family practice, or in your individual sessions that you have as well, if not picked up early, can it present as something else, as anxiety? Can it present as another symptom that you may see?
It's easy to misdiagnose. Hence, Yusuf saying somebody, they've got food additives, they have allergies, they have many other things. It's easy to misdiagnose. Teachers are overwhelmed. And you know, they got 40 in the class. Yusuf knows about that. So it's easy to just give a label. And you could misdiagnose a child who actually has a food allergy or who is just overdosed on sugar. I mean, I saw some research that's why schools are stopping these, because by just after first break, they notice kids become exceptionally hyper because they go to the tea break and then they have all these sugar straw things and stuff. And they come back in the class and then they're like wired. Right. And so they can't sit quietly. So the research I saw, teachers really have recognized that after first break is where the class is most disruptive. And that's directly linked to if they're buying fizzy drinks and lots of sugar. You're hyperdosed on that, and then you can't focus and concentrate.
What's the stats like with adults dealing with ADHD?
Yeah. So with the adults, it's usually people kids who were not diagnosed before and now have the same issue. But in adults, it's more complicated because the impact affects an entire family.
Right.
So whereas if you're a child, it's just affecting you and your studies. Right, and maybe your family, but as an adult having adult ADHD, now you're not completing your tasks. Okay, you're getting fired, probably you're disciplined a lot, and it then impacts the family income. It impacts the whole family structure. So adult ADHD is a thing.
Right,
it's real. It's not again some lazy adult, because I don't think any adult wants to get fired.
Of course,
I don't think any adult wants to not complete their tasks at work. They don't want to be called into meetings every week to say you're not meeting your deadlines. And there's different as somebody who doesn't have the skills. That's a different matter, right? So we're assuming competence, and we're assuming adequate levels of intellectual abilities, but still unable to get through the task. But all the other colleagues are getting through the job.
Right.
So the impact is quite enormous, and they don't realize that they have this condition, and that this thing like medication could help.
Right.
Yeah.
I want to bring that back to medication for a little bit now as well. Has it changed? You know, we living in a very progressive world, and I use that in inverted commas. Has it changed the treatment when someone goes on medication that has ADHD?
Yeah. So it's quite a fascinating area, because today I heard of a new medication for the first time.
Okay.
So I got this young man, he's probably in grade 1, and the parent went through a list of medications they've tried, and they said, this one works, and I've never heard of this one.
Okay.
So there were about 5 different treatments already that this young man was on. So it's a growing area, and like I said to Rafiq earlier, there used to be this one medication that was prevalent for years. Okay. And I think up till about 20 or 30 years ago, that was the go-to medication. It's still on the market, but others have developed. And the reason is fairly simple. You need to refine the medication and to make sure that certain medications don't present with particular side effects. The parents come back to me and they say, that medication works for us because it doesn't affect his appetite.
Gotcha.
That one, however, affects his appetite. So now we know for that particular learner, that's the one that we're going to go for. When I take that, he has sleepless nights, he tosses and turns, he wakes up quite tired in the morning. So each medication seems to have a particular reaction with particular individuals. old and young, that we have to make sure that we find the right kind of medication and the right dosage for them.
This sounds like very specialized treatment, diagnosis. You know, our government facilities, are they equipped to deal with ADHD?
No, they're not. I think that's one of the biggest concerns we have. Because at the moment, there's a particular medication that is affordable to provide to the masses, but it's not as effective as it should be.
And it's a general, I would imagine.
And so, so that's the go-to for people. And I think that's concerning because it does exactly what Rafiq said. Just like the sugar spike, you have the medication spike. It spikes and it drops. And so by 1 o'clock, 12 o'clock, the kind of productions you want from the child, you don't get productivity. So I don't think we have the ideal medication in the public service, but hopefully that will change as well.
Inshallah. What is your advice? Let's start with Rafiq, for a family that's watching this interview, has maybe picked up a few things that were mentioned and said, I'm not sure, but what is your go-to advice for them to be certain of how to deal or whether they have ADHD in their family or a child has ADHD?
To get the child assessed. That would be
someone
the
like
first
Dr. Yusuf.
standing right. Yeah, you can start there. Start with the GP, who can then refer them. Because most people have a GP,
right?
And most people don't know about psychological services. Although shows like this help because we expanding people's knowledge. So, but the point Yusuf was making is that it's accessible. That is a word, It is accessible. You can assess it
and accessible.
You can give it a label, you can know what it is, and once you know what it is, it's then easier to treat. And as Yusuf said, there's many ways to treat the medications. I know some parents are reluctant to go on to meds. There's a big discussion. They fight with the psychologist or the psychiatrist, the whole thing. They want to try natural remedies. That's not a terrible thing.
Right.
So, I mean,
it's still such a taboo topic to be spoken about. This is where we need to get over that as well. Dr. Yusuf, in closing, any last message you have to our audience with regards to how better to deal with ADHD?
So we haven't exhausted the topic of medication, but I think there are two issues here. I think the one is there are the possibility of alternative medication. So we're not excluding that completely. And so when a parent comes and I said, can I try this, can I try that? I said, by all means, if that's your preferred choice, then let's do it. Dealing with parents and children with ADHD is actually a journey. It's not a treatment that ends in a year. They come back to you when they're in primary school, preschool, primary school, high school, and university. So at the moment, I have 50-year pharmacy, dentistry. I have, so it's a journey. And at each point, there's a different need that needs to be addressed, and we can look at it and see what would best suit you. So in conclusion, I would suggest that parents do exactly what Rafiq has indicate. The service is available. It's accessible. And very often people look surprised that you're based in Athlone. I thought this service was meant to be somewhere else.
In a more affluent community.
In a more affluent area. It's right on your doorstep. And we can provide a fairly comprehensive assessment, and we can provide you with a complete form of treatment that impacts on different areas of the child's life, the stuff that you brought to us, and more than that.
Brilliant.
And that's what we are hoping for.
Gentlemen, thank you so much for coming into studio. Appreciate all the work that you do in our communities as well. Have a wonderful evening. Assalamu alaikum.
Wa alaikum salam.
And that's how we end Hilaal Live. We're back tomorrow between 7 and 7:30. Thanks for tuning in from the Cape Town team. Have a great evening. Assalamu alaikum.